Hi, my name is Jessica Gomez, and I am a part of Group C for Med 450. Today, we'll be going over suicide rates within the veteran healthcare. This will also be presented by Juliet, Reagan, Yusuf, Hazel, as well as myself. We'll be going over the issue, causes, the critiques, the organization, as well as the leader. For the healthcare problem, we are looking into how high are the suicide rates within the veterans healthcare system. Veteran suicide doesn't only affect the individual, but also those around them. This is not a new topic of concern. As you can see in the first point, veteran suicide has increased roughly 4.5% from 16.4 thousand in 2001 to 17.2 thousand in 2019. So there has been kind of a steady, I'd say steady veteran suicide rate over the past 18 years. And then also the suicide rates of between veterans and general US population was at its peak in 2017, marking 66.3%. Lastly, over 20 veterans commit suicide a day, and around 3/4 are not under VA care. VA stands for Veteran Affairs. There are still ongoing research to better identify the risks of suicide among this community, as well as finding ways to combat the risks. Causes, what are the root causes of the issue? Some of the largest risk factors could be mental health conditions as anxiety disorder, manic depressive disorder, depression, post-traumatic stress disorder, PTSD, and traumatic brain injury, TBI. Also, an increase of substance use or abuse. In this case, more than 1 in 10 were diagnosed with substance use disorder. Veterans who abuse substances are more than twice as likely to commit suicide than other veterans. Going along with the substance use or abuse, there has been high doses of pain medications such as opioids. That could be a risk factor as well. In addition to this, people who abuse drugs or alcohol are also most likely to develop one or more of the mental health conditions listed in the slide, such as anxiety, depression, and manic depressive disorder. As with any other healthcare problem, chances of suicide increases if more than one of these risk factors are identified or can be identified. Some suicide warning signs are episodes of intense anger, rage, and or mood swings, severe anxiety and signs of frustration, increased alcohol and substance abuse, as stated before, as well as self-destructive or risky behavior, and lastly, expressed emotions or feelings of suicidal thoughts. So these are some of the big causes that could lead to suicide rates in the veteran community.
All right. Thank you so much, Jessica, for going over the first couple slides. And my name is Yusuf. I'll be going over the critic slide, which pretty much focuses on the counter arguments that are being made towards a topic. So to start with, this topic was more of a one-sided topic, hence why I was not able to find a counter argument focused on arguing that the suicide rate is actually low, not that high. However, I decided to focus on some arguments that were made to justify the rate. Start with, while reading the National Veteran Suicide Prevention Annual Report for the 2022 year, the report kept mentioning how the suicide rate for the veterans is lower than the public's suicide rate. For example, the veteran suicide rate for 2018 was 13.8% compared to the general public, which was 5.4% less than the 2005 veteran suicide rate. And that rate is not taking into pretty much the aspects of how veterans are only 8.1% of the population. And if you do the math, that's pretty much 17 veterans die a day, while the known number for, or the estimated number for the general public is around 13 to 10 people a day. And that shows you how it's actually that veteran suicide rate is high up, and it's not lower than the general public. Furthermore, the second argument that I found talks about the excessive budgets that are being awarded to the military. For example, that $768 billion that was awarded in 2022 to the Pentagon, what drives that argument more deeper, it was $24 billion more than what the actual requested number is. And pretty much during the voting process, the Pentagon was approved to get an extra budget of $24 billion that they did not need. However, they were approved and voted to receive that budget. And over time, if you take those factors and those extra budgets, over time, the military is estimated to receive half a trillion more funding than the non-military, which is pretty much school, public services, hospitals. And at the end of the day, all these extreme budgets are being defended as the budgets to protect the troops, hence why all these budgets are being approved. Therefore, the suicide rate should be going down, not up. And the next slides will focus on the organization part and how those budgets are helping the organizations.
Hello, my name is Juliet, and I'm going to be presenting the next section, which is going to be about an organization that helps with the issue. The Defense Suicide Prevention Office, also known as the DSPO, is an organization part of the Department of Defense and was created with a purpose to lower suicide rates for veterans and their family members. The DSPO ensures that suicide prevention programming is evidence-based, sustainable, meaning that it is capable of being implemented, staffed, and funded, while also having the desired outcome of effectively contributing to the decrease in military suicides. Their mission is to advance holistic, data-driven suicide prevention in the military community through policy, oversight, and engagement to positively impact individual beliefs and behaviors. They also seek to instill systemic cultural change. A little bit of background information about the DSPO is that they were established in 2011, so they have been around now for a little over a decade. They provide a range of both medical and non-medical resources for suicide prevention and intervention. They also aid in postvention, which is the response in the aftermath of suicide that is used to promote healing and further mitigate the negative effects of being exposed to suicide. The DSPO works very closely alongside other agencies and organizations. For example, they closely collaborate with component and service level suicide prevention program managers and the Defense Health Agency. One of the other resources that is connected to the DSPO is Military OneSource, which is an organization that provides stress and mental health support, as well as other housing, financial, legal, educational, and recreational services. I also included the Military Crisis Hotline, which is a resource included on the official DSPO website. It is available to all veterans, as well as their family and friends, and it connects them to a counselor who can help. Finally, I would like to finish with the strategic goals the DSPO strives for. Data surveillance, program assessment, outreach and education, advocacy, and policy oversight are the most important roles that the DSPO fulfills. They are the primary coordinators for suicide prevention policy and keep the Department of Defense updated by being an authoritative source for suicide data. All of these goals would not be fulfilled without an effective leader. In our next section, we will be talking about a key leader of the organization.
The key leader of DSPO is Director Dr. Karen Orvis. What are the duties of a DSPO director? Dr. Orvis is responsible for policy, oversight, and advocacy of the U.S. Department of Defense Suicide Prevention Program in the Office of Under the Secretary of Defense for Personnel and Readiness. How would the problem be managed? Dr. Orvis states in the DSPO site that the department is fully focused on implementing and evaluating a multifaceted public health approach to suicide prevention. The departmental values are based on the following approaches: holistic, innovative, data-driven, collaborative, and integrity. Some positive traits a DSPO director has are cohesive collaboration. Dr. Orvis works with other departments, for example, the Department of Veteran Affairs, Substance Abuse and Mental Health Services Administration, National Guard Bureau, and others. Another characteristic or trait a DSPO director would have is the true colors The green section, analytical and logical. Conflict management practices direct speak. For example, Dr. Orvis states, "There is no one fix. The department is continuing to provide relevant programs, resources, and professional support to help service members achieve financial readiness, maintain skills to make informed financial decisions, and meet personal and professional goals throughout the military lifecycle." Ethics and integrity. Our efforts must address that many aspects of life that impact suicide, and we are committed to address this issue, not only because it affects our missions, but more importantly, because it is a moral responsibility to take care of our people. Some of the negative aspects of leadership and how to improve. Some common negative traits among leaders. Desire to change. Decision without proper analysis. An improvement would be a leader's strong values can help when both time and information are limited, but demands are endless. Another negative trait would be lack of time, results in burnout and stress due to the constant pressure to produce or decide in a limited time. It can cause communication problems, less interaction among leaders. An improvement would be managing time more effectively and being transparent with the team. Litigious environment, which results in disagreements, disputes of matters, and could potentially cause legal ramifications. This occurs when leaders have had no prior knowledge of or experience with the matters at hand. Their decisions are often based on best guesses, a risky and potential fatal move. An improvement for that would be hiring personnel from within the organization. The book does state organizations have realized that searching for candidates from outside the organization is no longer a viable option.